If you live with severe relationship anxiety, you already know the paralyzing reality of it. You spend hours trapped in your own head, desperately searching for a clear answer about your partner. On the surface, this usually looks like constant reassurance seeking, checking your partner's phone, or dealing with relentless waves of jealousy. To an untrained eye, those actions look like the exact same problem, but clinically, those identical outward behaviors can stem from two separate conditions: Relationship OCD, known as ROCD, or Pathological Love, which is commonly called love addiction. Getting this distinction right is critical. If a professional applies the treatment framework for love addiction to an ROCD patient, or vice versa, it will actively worsen the symptoms. Trying to fix the outward actions without diagnosing the underlying brain mechanism driving them is a clinical trap. Clinicians distinguish between them by evaluating how you relate to your own thoughts. They look at whether your experiences are ego-dystonic or ego-syntonic. ROCD is distinctly characterized by ego-dystonic thinking. In this comparison table, an ROCD sufferer experiences intrusive thoughts as alien and unwanted, causing intense shame. In contrast, love addiction presents as ego-syntonic. The craving feels authentic and justified. The ROCD patient suffers from unwanted thoughts. The love addict suffers from unfulfilled desire. The same relational theater hosts two different internal architectures. Escaping requires a different map. Let's look closely at the ROCD presentation. The primary driving force here is the fear of making the wrong choice. This manifests in two ways. It can be relationship-centered, where you doubt the rightness of the bond, or partner-focused, where you fixate on your partner's perceived flaws. The brain demands 100% certainty before moving forward. Because absolute certainty is impossible, the person is pushed into compulsive checking and exhausting mental review. As you can see in this flowchart of the brain's circuitry, ROCD is an issue with the threat detection system. A relational ambiguity enters the system and triggers a massive false alarm in the amygdala, spiking anxiety. In ROCD, the relationship isn't the problem. The broken threat detection loop is the problem. Pivot to love addiction, and here the core fear is not making the wrong choice, but the existential terror of abandonment. Clinical research links this abandonment terror directly to early childhood emotional neglect, abuse, or disorganized caregiving environments. Because of this, it heavily overlaps with borderline personality disorder traits, showing up as a frantic pursuit of the partner followed by cycles of idealization and devaluation. Reading this medical literature, you'll see love addiction defined by an abstinence syndrome. When separated from the partner, the distress literally mirrors physical substance withdrawal. Healthy attraction rigidifies. Desire shifts into a necessary need, and the pleasure of the relationship turns into suffering. Neurobiologically, this recruits the brain's dopaminergic reward pathways. That places love addiction firmly on the behavioral addiction spectrum rather than the OCD spectrum. The patient is attempting to use another human being as a biochemical life raft to regulate overwhelming childhood trauma. Because these mechanics function differently, reaching a precise differential diagnosis dictates the entire recovery path. For ROCD, the gold standard highly effective treatment is exposure and response prevention, or ERP. Returning to our decision tree, you can see how this works. ERP purposely triggers the relationship doubt, and then therapists work with the patient to prevent the compulsion to check or seek reassurance. Applying ERP to a love addict is critically contraindicated, ignoring their core trauma. Instead, love addiction requires dialectical behavior therapy and trauma-informed care. Conversely, applying trauma therapy to an ROCD patient fails because probing for deep trauma meaning validates the OCD's false alarms. The right therapy builds a solid foundation for healing. The wrong therapy inadvertently reinforces the disease. On this scorecard, ROCD is a disorder of doubt. Love addiction is attachment hunger. If unwanted thoughts ask, "Do I love them?" seek an OCD and ERP assessment. If you fear ceasing to exist without them, seek a trauma and DBT assessment. There is also a complex overlap zone. Clinical research shows these two conditions can occasionally co-occur in confusing ways, with patients experiencing both intrusive doubt and attachment hunger simultaneously. Because these lines blur easily, professional intervention is the only safe way to untangle the web. Do not attempt to self-diagnose these conditions, and do not rely on generic internet relationship advice to fix this. The experts at Edward, Jenny & Associates in Kennett Square, Pennsylvania, are equipped to help you navigate this. Their practice offers the nuanced, evidence-based psychological assessments necessary to differentiate between these complex relational issues. Reach out to them today to get a highly targeted, effective treatment plan built specifically for how your brain works. Reclaiming your mental health and finding peace in your relationships starts with getting